This is Ruth Petran. I'm Senior Corporate Scientist leading technical information related to food safety and public health at Ecolab. And I'd like to share with you new information about novel coronavirus. Obviously, this is an evolving situation, and I'd like to just update you on where things are today. So our goals for today are to share expertise about this novel coronavirus and public health, and to provide guidance to you on how to keep employees and customers safe. What do we know about novel coronavirus? Well, this was identified by Chinese public health authorities in late December and has been named COVID-19. This is novel because it was not previously seen. We know it causes primarily fever and respiratory symptoms, and to date has infected tens of thousands of people with thousands of reported deaths around the world. Public health authorities are continuing to actively investigate this outbreak, and the situation will and is evolving. Coronaviruses are a large family of viruses that cause a wide range of illnesses, including a lot of common colds that we all suffer from. But there are a couple more severe versions of coronavirus that we've seen through the years, including Middle East Respiratory Syndrome, or MERS, and Severe Acute Respiratory Syndrome, or SARS, that have happened in the past. This COVID-19 is a new strain that had not previously been identified in humans. Again, these coronaviruses are fairly common, and they can be transmitted between animals and people. In fact, we know that there are some circulating in animals that have not yet infected us. Common signs of infections tend to focus in respiratory symptoms, often with a fever and others listed on the slide. But in more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and lead to death. We know that coronaviruses can spread in a variety of ways, and it does depend on the particular one we're talking about. But the reality is they're rarely spread by fecal contamination, but may be spread from an infected person to others through the air, in droplets from a cough or sneeze, by close personal contact, such as touching or shaking hands that might be contaminated with these respiratory droplets, or touching an object or surface that has the virus on it, then touching your mouth or nose or eyes before you wash your hands. The graphic here illustrates this. The reality is we are seeing transmission from person to person with COVID-19, but it's really occurring only among these very close contacts, such as a healthcare worker caring for ill people, or a caregiver, perhaps at home, maybe a spouse of someone is sick. Surveillance is continuing. The good news is that we can take steps to help protect public health. And the recommendations that we're hearing from public health authorities really do focus on standard infection control practices, training on those, and compliance to them. So we will talk through these on the subsequent slides. First and foremost, and we hear this from every official that's out there, is washing your hands. If soap and water are not available, they recommend that alcohol-based hand sanitizers can be helpful. But washing your hands is for sure the #1 strategy to follow. Wearing a mask is only recommended if directed so by healthcare or by local requirements. The reality is there are shortages of masks around the world, and it's very important that the people most at risk, that is healthcare workers, have access to this very important part of personal protective equipment. So please only consider wearing a mask under these specific conditions. Also, we need to stay home if we're sick. Avoid close contact with others if we're sick. We need to practice proper sneeze and cough etiquette. That is with a tissue, and then throwing that tissue in the trash or into a crooked elbow, and then certainly washing your hands. Seeing a doctor or contacting medical professionals is important, and then cleaning and disinfecting objects and surfaces is also helpful. But what about what you should do within your business? First of all, think about your own employees' health and make sure that they are following these hygiene practices, especially proper hand hygiene. Disinfecting of hard surfaces and high-touch areas, including railings, doorknobs, handles, restroom surfaces, countertops, and so on, is important. Where needed, it's important that the right personal protective equipment be available. The good news is that coronavirus is a so-called enveloped virus, which relates to its structure. And we know that these enveloped viruses are the least resistant to disinfection, which means that disinfectants can be used to effectively kill coronaviruses on surfaces. You do want to reach out to your sanitation partner, though, to get an understanding of what specific products might be recommended. A question we get very often is, how long does coronavirus survive on surfaces? We don't have data specifically about COVID-19 because, frankly, it is just not available for study yet. Using data that we've gleaned from study of previous coronavirus, such as the SARS virus, indicate that this could be a time period anywhere from hours to potentially days. But what's really important is that we need to consider the potential for transmission from a surface. And I was with the CDC recently, and they reiterated that with COVID-19, there is no evidence of transmission from a hard surface to a person in transmission of this disease. So while, yes, there is a theoretical risk, the practical reality is that it has not occurred. That said, it's very important, though, to focus in on cleaning and disinfection. So what does this mean in a hospitality space? Well, firstly, following local public health recommendations, and with expansion of illness, we're seeing more and more of these very localized to particular cities and regions. Certainly making sure all your employees are well informed about proper infection control procedures. Reinforcing, guess what? Personal hygiene, things related to hand washing, covering your cough, and so on. Making sure they have the right materials available, such as soap, alcohol-based hand rubs, and hand sanitizer. You may want to provide these to guests and employees throughout your property. Cleaning and disinfecting surfaces and high-touch objects with the right disinfectants, such as the sites listed. For restaurants, again, following local public health recommendations is important. And again, reinforcing personal hygiene throughout the organization. Providing the right materials in order for that to be accomplished, and then cleaning and disinfecting surfaces and high-touch objects with approved disinfectants, including things like menus, waiting areas, tables, chair backs, things that get touched frequently. For food contact surfaces, it's really recommended to follow your routine food contact surface procedures. Disinfection of food contact surfaces is probably not needed on a routine basis. However, there might be instances where it could be reasonable if, for example, that particular food contact surface might have been exposed to a person who is suffering from coronavirus. But that should be a fairly remote occurrence, but it is something to keep in the back of your mind as you may want to consider that. But certainly with any disinfection of hard contact surfaces and food contact surfaces in particular, it's very important that you follow the labeled instructions on the product. While we're on the topic of restaurants, we need to talk about food safety. And the good news is that there's no evidence that COVID-19 is transmitted to humans through food. So as always, standard food safety practices are encouraged. Thinking about how you're handling any animal products, whether it might be a live animal or raw or undercooked meats. Following standard food safety practices, avoiding cross-contamination, and properly cleaning and sanitizing food contact surfaces, including utensils, as well as your hands. For long-term care facilities, again, following local recommendations, making sure employees are well informed and have the right materials available, and that hand hygiene is reinforced, cleaning and disinfecting of high-touch objects where there might be potential access. So again, thinking about hand railings, elevator buttons, public areas, resident rooms, etc. You may want to consider closing non-essential public areas if the risk is elevated, or delivering food to residents directly. Another question that has come up is the worry about shipments that may come from China or from other parts of the world where illnesses may be occurring. The reality is that coronaviruses in general have relatively poor survivability on surfaces. So again, the risk of transmission from a product or a container like a hard surface is very, very low. And currently, as there is from food, there is no evidence to support transmission of the COVID-19, which is associated with imported goods. So please keep in mind that we're here to help you, and I urge you to connect with your Ecolab team for information about world-class training, programs, and tools. We do have webinars and other materials available. We can provide support, and certainly this is available 24/7 through our call center. Issues like COVID-19 can be scary, and we all can worry. But it's really important that together we can make a difference and think about what we can do to help minimize risks, and focusing in on those practices that can be helpful and are believed to be effective is really how we can help to reduce some of this angst that admittedly we are all feeling. I thank you for joining us today and urge you to continue these practices, including, guess what? Lots and lots of hand washing. Thank you very much.